All right, today's checklist all about our health by the decade. As the years pass, our medical needs change. So this morning we're going to cover some very important screenings starting in your 20s. Dr. Cedrek McFadden is back. Dr. McFadden is a board-certified colorectal and general surgeon. Good to have you back.
Good morning.
Hey. I mean, first of all, just how important in general are these screenings as people get older?
They're extremely important. Craig, here's the reality. We're getting older. You're aging. I'm aging, we all are, and that's the beauty of life, right? But as we age, our bodies become more susceptible to a wide range of diseases and problems, many of which, if we can find it early, can be treated or even prevented. And when we consider health screenings, there are several factors that we want to keep in mind. Number one, we need to find testing that is available, accessible, safe, not producing more harm than good, and many of these tests begin based on our family history. So we have to know that history. We also have to remember that based on the results of these tests, it could lead to more complex treatments like chemotherapy and radiation, which really goes into the equation of should we test, when we should test, and how often that testing should be done.
All right, well, let's start in our 20s.
Yeah.
Now, obviously doesn't apply to any of us, but or 30s for that matter. But 20s and 30s, what should folks be focused on in those decades?
So in this age group, I like to remember the phrase, start early and stay ahead, right? Because we want to prioritize health screenings to really set us up for a strong foundation for a lifetime of optimal health. And when we're doing this, the American Academy of Family Physicians, they tell us recommendations for screening for high blood pressure, diabetes, cholesterol, and even obesity. And if you have high blood pressure, you're going to be doing this every year. If you don't have any diagnosis already, this may be done every 2 or 3 years, along with cholesterol and diabetes testing by your mid-30s. Okay. The other one that's very important to remember is cervical cancer. The American College of Obstetricians and Gynecologists, they give recommendations to begin this in the 20s every 3 years. The one I really like on here is skin cancer, because there's no formal recommendations for skin cancer, but this is where it comes back to us. To every month, take a look at your entire body, back, front, side, all of it. And if you see anything that's abnormal, you got to bring it up to your doctor to evaluate it further.
Once we get into our 40s and 50s, I feel like we need all of this.
Correct.
And then have to add some more to it.
It continues. It continues. And this is where we get to the real meat of many of the cancers that we think about. Breast cancer screening, you'll hear by 50 you should be having that done. I like the American College of Surgeons recommendations that by 40 we need to start having that conversation and considering doing that every year. Colorectal cancer by 45, having a colonoscopy, and every 10 years if it's normal. Prostate cancer, we've talked about before as well, by your 50s or sooner if there's a family history. And many people forget glaucoma and really having a comprehensive eye exam. So this is more than just making sure your glasses or your contacts are fitting properly. This is the full thing, the dilation where you're wearing the funny glasses afterwards. You got to get this done, periodically once you reach the age of 40. And lung cancer, if you smoked, if you're a current smoker, you got to get this test done by your 50s every single year.
And then we move into our 60s, decade I'm familiar with. So it's this list, and then we add what?
So we add a few things. One of the ones that we like to talk about, especially in postmenopausal women who's reached the age of 65, screening for osteoporosis. Very easy test that you should have done, because we know that falls can be a great source of morbidity and mortality, and one of that.
Do men have to worry about osteoporosis?
They may have to worry about it, but the screening recommendations are primarily for women, and that's why your doctor's still checking for vitamin D as you age, do your routine visits as well. Cognitive impairment, we can't forget about just making sure we're all good up there, right? That's something that's going to be done during your yearly appointments with your doctor. And abdominal aortic aneurysms, if you are male, if you've been a smoker, or you have a family history, get a one-time ultrasound done in your 60s to make sure you don't have.
I didn't know that.
I've never heard of that. We only have like 60 seconds left or less at this point. Someone in their 70s or 80s above, what do you need to do?
Listen up now.
So often people think it all stops here, but it's very hard to have conversations with patients come into my office and say, I'm 80 years old, I'm otherwise healthy, can I keep going? And we individualize all the other screenings so it may continue. Things that we still have to make sure we do is talking about fall prevention, making sure that the home is safe, making sure that they're eating well, because those things can then extend life even further. Listen, we're all going to age. We want to do it gracefully. How we get there is our choice.
We want to age.
We do.
We want to keep doing it.
Beats the alternative, right?
Yeah.
It beats the alternative.
Thank you, Doc. Always great information.
Thank you so much.
And a great jacket.
That is
It looks like an owl jacket, actually.
I got to go over and feel it.
I did. Jacket envy.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.